One of the most marvelous advancements of using modern technology in the Lasik vision correction procedure, where in the space of 15 minutes many people can reduce or eliminate their reliance on glasses or contact lenses. There is very little preparation for the surgery on the Lasik patient side, and the Lasik procedure itself takes less than 20 minutes. With current technology and an excellent Lasik precision, there is a very high success rate for nearly all Lasik surgeries. Though not all patients get or keep exactly 20/20 vision, there is a vast improvement in the Lasik client's vision and dependence on corrective eyewear. The two most important factors under the patient's control is the choice of the physician and good post-operative care. After visiting a few physicians or clinics that perform Lasik procedures, the client should have a very good idea of how they will be treated as a patient of that doctor. It is important to find a Lasik physician whose staff is responsive to questions and worries and who are willing to see a post-operative Lasik client who is having a problem with their care. This is one of the more common complaints of those folks that undergo a Lasik procedure. Insufficient information about post-operative Lasik side effects, or a staff that simply says lots of people experience that, no problem, when the patient actually should be seen by a member of the staff. A visit where the prospective Lasik patients talks with both the physician and one or two members of the staff will get an idea of how well a patient is welcomed once the Lasik procedure is completed. During this initial investigative visit, the client should ask the Lasik staff for a list of common temporary side effects that can be experienced after a Lasik procedure. The staff member should describe any cases where the patient should make a point of contracting the Lasik center, rather than just enduring the side effect. Cases of pain, intense itching, or seriously blurred vision may indicate an infection or other serious problem and should be seen promptly. It is truly very rare that any of these complications exist after a Lasik procedure, but make sure that the center is willing to see the patient if they think something is more than mildly wrong. One of the more common side effects after a Lasik operation is some form of dry eye, which often occurs during the nighttime while asleep. Not only is this uncomfortable, but if the eyelid sticks even slightly to the eye itself, it may dislodge the surgical flap done in the Lasik procedure and delay healing of the eye. If this occurs, the Lasik center has several different viscosities or thicknesses of eye drops to alleviate this problem. The staff should be promptly notified so this problem can be addressed immediately. A good responsive staff surrounding an excellent Lasik physician is the most important component in how to select a doctor. Interviewing the physician and staff about all aspects of the Lasik procedure, both the procedure itself and post-operative care, is the best way to make an excellent choice. You can find more useful information about how you can cure myopia at www.cureMyopia.com.